Welcome back to Meet Yourself, and we're talking about navigating midlife metabolism in our women's group, and we're talking to Dr. Laurell, and we're just doing a combination of some clinical with some research. Both of us are sharing our insights so that you can have your questions as best answered as possible. So today's question is, let's see, can stress management and sleep quality affect my metabolism in midlife? So I'm going to let you start, Laurell.
Oh,
What do
yeah.
you
I mean, this is such a significant issue and two interrelated issues. So if we're dealing with a lot of stress and our body's producing a lot of cortisol, the stress hormone, that definitely has a negative impact on our metabolism, kind of encouraging the body to store more of our carbohydrates as fat. And then the other layer is sleep. So if we have more cortisol, that negatively impacts our sleep. And then if we're sleeping poorly, guess what? That raises our cortisol. If we're getting less than 6 hours of sleep per night, they've shown that it increases your cortisol the next day and makes you more likely to crave high sugar and high fat foods.
all those sweets? I love sweets. I really do. It seems like we like more sweets when we don't have the mechanism in which we can absorb the sweets correctly with the estrogen
Mhm.
loss. That's what I have found. But, we talk about sleep. I also like to talk about rest. And, when I work with and instruct, giving people the tools for their own meditation and relaxation, I really talk about the difference between sleep versus rest. So if we're tossing and turning, we're really talking together here, just restful sleep. And we do need that because, as I discussed in another, or I should say, I mentioned in another take in one of our questions, the brain really needs to rest so that the fluid can actually wash. Think about fluid washing the brain, the cerebral spinal fluid, going through the brain and cleansing it and detoxing
Yes.
overnight. And if we don't provide that restful situation, we will have a spike in our cortisol, our stress, because what is stress, everyone? Stress is a perceived threat. So anytime we feel, and we have a higher level of consciousness here we're talking about, right? When we are really in touch with ourself, we know when there's a danger. So if we're eating junk food laden with chemicals, you might not be surfacely aware of what you're doing. I know I haven't been in the past, but the body, the consciousness is recognizing that as a threat, not getting enough nutrients, not getting enough of what the body and brain and even the mind, what is needed for sustainability as well as health. That is a stressor right there. And cortisol can be released because of that. That's
Mhm.
why when we talk about stress, people are just thinking they have to see it, but we're talking
Right.
even subtle here with a poor
Yes.
diet. Would you agree with that?
Oh,
Or,
absolutely. Yeah,
yeah,
there are the obvious stressors, that we think of, are
sure.
strained relationships or problems at work, but other things, excess noise and things that we don't think of as stress can have a profound impact on us too.
Well, remember when I said, when we've had our discussions, I don't know if we were on recording when I had said it. I remember when the house we had dogs, and I love four, not four-leggeds, and I know you have cats. And when I used to turn my router off at night, everybody would rest. So
Hmm.
there's a habit in our home to turn off the routers and the electronic devices in the evening. It produces a calmer environment, which helps alleviate the stress. It's
Yeah, that's a very
amazing.
good point. The
It's
stress on our bodies from some of
right.
these electromagnetic fields that our ancestors never experienced.
That's right. And I know people say we have to progress and et cetera, et cetera. Yeah, we're progressing to extinction because we're destroying the human organism with
Hmm.
our technology. If we developed our spirituality the same way we developed our outer technology, our inner technology, the same as our outer, wow, we'd all be
Yes.
flying in light. There'd be no
Hmm.
hostility, anger, animosity. No one would be polluting the food chain because there would be an awareness there to serve
Hmm.
humanity. So we talked about stress and sleep, all of these things, and just what I didn't go off the subject by talking about the psychological ramifications that we have within our culture that are really disturbing the human
Yes.
the human biome, including the mind
Mhm.
also. And
Yes, yes. And yeah, unfortunately our culture has some unhealthy attitudes about rest and sleep. Sometimes people have permission, trouble giving themselves permission to have restful time for themselves. And so we need to embrace that and also do what we can to improve our sleep quality. So many of us are deficient in magnesium, and magnesium is one of those calming minerals for the brain. So, sometimes we have to look at our nutrient intake, whether it's through foods or supplements, and optimize some of those healthy, relaxing nutrients to have better sleep.
you know, when I started perimenopause, I didn't even know the greatest thing is I was ignorant of all of that. And I remember without, even though I have my training in nutritional biochemistry, just one day I said, I need to have magnesium. I didn't know anything really about it. Now I write about it, right? All the
Mhm.
biochemical
Yes,
reactions over
yes.
400. And I
Hmm.
started taking it at the time I started going through perimenopause. And up until
Mhm.
this day, do you know, I take it every night before I go to bed.
Yes.
Of course, if I use zinc, I don't because they compete for uptake, but
Mhm.
I use it and I found it the most wonderful mineral. I'm not telling everybody to go out and do that, but
Mhm.
as you said, magnesium is a wonderful nutrient.
Yes.
Of course, you can get it in your food, but even foods today are probably deficient and they're not as packed full of the nutrients that are
Mhm.
needed for our brain and our
Yes.
metabolism.
It is unfortunately so true that, we used to be able to do more things just through diet, but because of the soil depletions, especially when it comes to minerals, we
Yeah.
are needing to do more supplementation, and that's absolutely right. And sometimes I'm adding other supplements to the picture, supplements to help manage our stress response, like
Sure.
the adaptogenic herbs like rhodiola. Those are such wonderful herbs because they modulate our stress response. If we're producing too much cortisol, they can help the body calm that response. And then that's one of the reasons why rhodiola, even though you might be taking it during the day for improved energy and well-being, might also help you sleep better at night.
Understood. I use ashwagandha for that. But anyway, we all have our adaptogen that we like, and everyone's unique. I know when you see
Mhm.
patients, I'm sure each patient has a unique thumbprint, unique
Yes.
biochemistry. And
Hmm.
that's the beauty of really working with the whole organism in a balanced way. With stress management, if someone comes and they're stressed, and lots of times we don't even know that we're stressed or their sleep, you look at the whole picture. You look at what the diet,
Yes.
how is the diet producing stress? Is the exercise producing stress? Are your relationships producing stress and lack of sleep? It's the way we're thinking. How do we detox the mind and really allow the body to rest and get the proper sleep?
Mhm.
And that's where we work with the classes and meditation and work with the herbs that we're talking about in diet.
Yes. Yes. Support the whole person,
That's right.
physically, mentally, emotionally, spiritual, to help them meet themselves.
And maybe adopt a four-legged in between. Okay, thanks again. We'll see you next time with more questions.